One second. Yes, we can start.
Hello, everyone, and welcome to the session on chronic pain, chronic pelvic pain, actually, to be very precise. And today we are here to talk about the constant pain that a lot of women go through. So we have with us Dr. Vimee and Dr. Sona. So Dr. Sona Kakkar is a registered psychiatrist, and she has an additional training in intensive short-term dynamic psychotherapy, which is a contemporary form of psychoanalysis in a shortened format from the ISTDP Institute of Washington. She combines different psychotherapy techniques, giving an acute attention to what may be the most useful intervention depending on the presenting problems. So, what are the kind of problems that that she deals with? So she deals with patients with migraine, tension headaches, depression, anxiety, panic attacks, self-harm, post-traumatic stress disorder, childhood trauma, protracted grief, and addictions. As of now, she practices out of Hyderabad. Dr. Sona, welcome on this show.
Thank you, Shilpa. So glad
Our,
to be.
I think this session is something which we've been waiting for a very long time.
Yeah.
Yeah. So with us, we also have Dr. Vimee Bindra. As we all know her from before, she is a consultant gynecologist and laparoscopic surgeon at Apollo Hospitals, Hyderabad. She specializes in fertility enhancing surgeries and endometriosis excision surgeries. She has special interest towards raising awareness for endometriosis for gynecological patients and gynecologists. She has also produced a short film called End the Silence as a part of endometriosis awareness. She understands that endometriosis is extremely tough and is working really hard towards increasing the awareness as a part of endometriosis awareness. She has started her group called Endo Crusaders with me, Dr. Shilpa, for raising this awareness. And I am Dr. Shilpa Rao. I am here to welcome you all again to this session on chronic pain. I myself am a general dentist and I've been practicing for the last 17 years and an endometriosis crusader. I have a chronic pain constantly for the last 4 to 5 years. And trust me, it is not easy. So let's begin this session by asking Dr. Vimee that, Dr. Vimee, you are seeing a lot of patients who have endometriosis and pelvic pain. So what are the few things which you recognize in a patient without the patient telling them themselves?
Hi, everyone. Thanks, Shilpa, and thanks, Dr. Sona, for joining us for the session. Yes, chronic pelvic pain constitutes a major part of our gynecological OPD. And there are various causes which causes this kind of pain, and anybody who has experienced it for more than 6 months, we call it chronic pelvic pain. There are several causes such as fibroids, pelvic inflammatory disease, pelvic congestion syndrome, irritable bowel syndrome, interstitial cystitis, and one of the most important causes is endometriosis. Now, endometriosis usually affects 1 in 10 women, and more than 200 million women are suffering worldwide. And this is the most common cause, and this is the most dismissed cause, I would say, because painful periods for ages, women have been told that it's normal. So when these women who have been suffering for years come to us, apart from them telling us what they are going through, we can sense a lot of things if we talk to them. One is, nobody listens to them. This is the main complaint that doctor, I tell them that I have pain, but nobody believes me. And
Absolutely.
from childhood, they were told that it is normal and women have pain. My mother had, my grandmother had. So I would say women are not meant to suffer. So if
Correct.
she's saying there is something, so there is something in is there physically. And if
Hmm.
we don't pay attention to them, I think it is affecting them mentally as well, which is
Correct.
affecting their relationships, which is affecting their family life, where they can't pay proper attention to their children's education. They can't play with their children if they have that pelvic pain. They have problems with their sexual life and marital life also. So these are the most common problems which we are facing, and then they feel dejected and they don't feel happy about it. And slowly, I think it builds up and leads to a different kind of a person they are. This they don't tell us actually. They come to gynecologists and they tell us about the physical issues only, but we can sense them that there is something wrong. So this, I would suggest that this needs to be addressed, and I would like to ask Dr. Sona, what does she feel about it? She must also be seeing many patients coming to her with anxiety and depression associated with pain. So when it becomes, I think, critical or it worsens, then I think they visit for counseling or to a psychiatrist. So I would like to ask Dr. Sona, what is her opinion about it when she sees these patients with chronic pain?
To me, you've given a very nice understanding that when patients come to us, and this is in generally in the medical profession, that when patients come to us with symptoms like chronic pain or pain, I mean, we are always looking for some anatomical, physiological, some problem in the body, and we're just trained to look for that. And most often there would be a problem, like you just said, there could be actually endometriosis, there could be something which is pathological, which needs attention. But oftentimes, what we don't know is that sometimes the symptoms are because of anxiety. The symptoms themselves are because of anxiety, and that's something new which is now coming into our understanding as medical professionals. Still, we're just trying to get people to understand that there could be a huge component of anxiety in the patient suffering, which as we are getting knowledge of this, we're getting to be able to identify and then take care of this anxiety. So the good news is, since most of these symptoms are because of anxiety, there's hope that there is treatment available. Now, like you just said, a patient who's been coming to a doctor over and over and over, and the doctor also is just treating the pathological part, and then we're really not picking up. Many times we don't know, we haven't got this information. The patient just gets disappointed, they get depressed. Other than that, they lose so many days of their productivity. Other than that,
Correct.
they have this family looking at their mother, the kids look at a sick mother all the time, and it really cripples their life. And obviously, they don't feel fulfilled and, as powerful as they should. And then it's obviously going to lead to depression and also a sense of hopelessness. They've been to so many doctors again and again and again, and then eventually people just tell them, "You just have to live with this. This happened to my grandmom, this happened to my aunt." Just tell them, okay, you just have to live with this. You're just going to understand that you're going to have less productive days than other people, you're going to suffer a little bit. But then what, like I said, we're missing is the component of anxiety. Now let's try and understand anxiety. So suppose we have an interaction with someone, and something about that interaction annoys us. We don't like it, and then we look at them and say, "So that's like exasperation." And what happens is that we are giving a signal that our body is now getting tense. And so what we notice is that there's a sigh, and that's a sign that something is getting triggered, and what's getting triggered is anxiety. And the question would be, why would you be anxious if you're annoyed at someone? And the answer is that when we are in close relationships, we we are fearful of our reactions. We are fearful of how we might express our real reactions. So, in as a child grew up and they grew up with their parents, in children who may not have a very secure attachment may find that it's not very easy for them to express their emotions to the caregivers, because it makes the caregivers very anxious. and then they just learn to hide their emotions, and in turn they just get anxious. And this anxiety, as I said, when we sigh, it just shows that it's following a particular pathway of discharge. And this pathway is what is called the somatic pathway, which is including all our voluntary muscles, the muscles that we use for movement, the muscles which are in our control. So this, we find that since it passes through this group of muscles, we might have a patient who says, I have a chronic backache, I have a chronic, headache, tension headache, or I get, serious cramps in my legs. And they actually experience there's a lot of tension in the body, which they actually experience as pain. And this is just a pathway from, one of the pathways which is used by, for anxiety discharge. So part of the central nervous system. And other than these symptoms, which a person can experience of chronic pain in the voluntary muscle groups, which are basically used for movement, we may have another pathway which the anxiety follows, which we call the autonomic nervous system. And some of you are aware of that. Maybe we have some people who are doctors here and aware of that, and other people who just know that this is the system which is basically the internal organs. It includes the blood vessels, and so a patient can complain of a migraine headache, or their blood pressure changes, or then it can include their respiratory system, the breathing apparatus. So they may have asthmatic attacks, or then they could have diarrhea, or then they want to go to the bathroom again and again, and or they have sexual difficulties, and so many other symptoms which are part of the internal organ system, which can also be a pathway where anxiety is discharged. So a lot of patients who have pain symptoms, you'll find that they might have a group of these symptoms. So patient can say, I have pain, but I also have a migraine, but I also have diarrhea symptoms, and I also have gastritis, and I have irritable bowel, and I have hypertension. So you find this whole pathway is activated when anxiety is discharged. So unless we can pick up that this is activation of their anxiety, and this is not happening one-off, it happens all the time, because whenever they are interacting, feelings are going to be mobilized in every interaction. Every time you talk to something will annoy you, something will make you happy. So feelings are going to be activated. But rather than experience their feelings, what they experience is anxiety. And so you find this very hesitant to interact with people. They don't really go out too much. They withdraw, because every interaction, they just come back with a headache. They come back with other symptoms.
So that means a lot of pent-up emotions is what generally triggers all these symptoms?
You could say that it's like a part of the person hasn't got the kind of signaling or in his life that
They don't really go
it's
out too
safe
much.
to express.
Because every interaction, they come back with a headache. They come back with other symptoms. So that means a lot of pent-up emotions is what generally triggers all these voice.
Yeah, there's a bit of an echo.
Yeah, that's okay. That's okay. Please continue.
Okay. So what happens is that
Signaling
in every relationship, we experience emotions, and
Facebook.
it becomes really hard for people who have had more insecure attachments to really express their emotions in every relationship, especially in the closer relationships, because they feel it's dangerous. If they express their emotions, it might just lead to anxiety. But this is an unconscious process. A lot of people don't know that, and that's where work begins, where they can start picking up that, okay, I didn't recognize my anxiety, I didn't recognize what's underneath my anxiety, I didn't recognize that the particular interaction is triggering my anxiety and it's leading to all my symptoms.
Okay. So, Dr. Sona, I also wanted to know, fine, these symptoms are there, but are these changes that happen in a person due to chronic pain, are these reversible changes, or there's a permanent change that happens in a person?
The good news is, since we now recognize that these are anxiety symptoms and we know anxiety is treatable, of course, you could treat it with medication or you could use other modalities, but we know that at some level it's the anxiety which is a problem. But we have help, because anxiety can be treated, anxiety can be regulated, and it can be even regulated by the person himself.
Hmm.
They learn how to recognize their emotions. And there are a lot of researchers who found that if you've just got a particular kind of pain and you just journal about it and think about what's the emotion underneath, what are you experiencing currently, the symptoms go away.
Okay.
So
So, yeah. So that means the medication, there are a lot of things which can be done to reverse the symptoms, is what you're saying.
yes, yes,
That,
absolutely.
that's a good news. That's something positive
It is
to
good.
hear.
It is wonderful. Yeah, that's really wonderful. Yeah.
Absolutely. I was going through the medication. Vimee, I think I'll come to you for this. I
Sure.
was going through medication for a long time. Obviously, I was given hormones. When I was diagnosed with endometriosis, I was given a lot of hormones, yeah, to control the growth of the endometrium and all that stuff. But leave aside everything, rest of the physical symptoms that I was getting. Besides that, I was getting a lot of depression, lot of anxiety, and the doctors were not ready to accept that I would be going through it. So tell me something. These medication, these obviously the hormone medication, which is given either for for endometriosis or for conceiving, for IVF or anything like that, does it have these side effects?
Shilpa, this is one question which needs to be addressed, and women also need to understand that they are being given a lot of hormones which really have a lot of side effects. Now, endometriosis, mostly there are many school of thoughts when it comes to treatment.
Hmm.
Some people treat it only with medicines. They are against surgery.
Hmm.
And evidence has shown that excision surgeries are the best to give the pain relief and also as a fertility enhancing measure. But
Correct.
still, I would say general gynecologists and others are treating endometriosis mainly by medications. And these are hormones, mostly progesterones or their derivatives, leupride like GnRH analogs, oral contraceptive pills. And these medications, rather than treating the disease, they are being given for pain mostly, or they are being told that it will prevent the recurrence or it will reduce your endometriosis, reduce your cyst size and all that. But these hormones come with their own set of side effects, and now these are pharma driven. The
Absolutely.
companies have pushed them so much that they have occupied a dominant portion of the treatment of endometriosis in the market. So these medications, progesterone, let's talk about GnRH analogs. GnRH analogs, what it does, it produces a state of menopause in the body.
Correct.
It might reduce your symptoms, it might reduce your pain. That is a masked advantage of these medication. But
Hmm.
once a lady is menopausal, whatever changes happen in the body, all changes happen with these drugs.
Absolutely. I
It
I
causes,
completely.
it causes mood changes, it causes depression, anxiety, bone changes, it causes heart diseases as well. It affects the cardiovascular system. If we talk about progesterones, depression is a major side effect of progesterone therapy. So with these drugs, already these women are having pain, and they have a component of anxiety and depression with their pain. And aren't we pushing them further towards these anxiety and depression?
Yeah, to the edge completely. True.
Yes, so this has to be addressed, and we need to understand that just putting women on hormones for endometriosis doesn't help. There is something more than that. Yes, for some women, yes, it does help. I wouldn't say that absolutely no for any women I will see with endometriosis and I'll operate. It's not like that. Yes, it is case based, but these are not the solution. They
Correct.
are producing a lot of side effects which are not being told by the patient because they're not aware.
So,
They don't understand. Sorry, tell me.
so that's what I was coming to. So, since as okay, fine, as a medical professional, I knew what I was going through. So, a lot of women would not even realize what they're going through, right?
Yes,
So,
because they're not aware about it.
correct. So, don't you think it is necessary for a practitioner to tell the patient that if you face anything like that, then you have to report back to us?
I think they should be given a checklist of symptoms. If they develop any of these symptoms, they should report back immediately. And
Absolutely
also, if they develop any symptoms of anxiety and depression, I think Dr. Sona will be addressing that as well. If they
correct.
face any of these drugs should be discontinued immediately. So these hormonal drugs are really pushing them into the well of depression and anxiety. That is what I believe.
True.
Rather than these drugs, if they are encouraged to do a little bit of, along with the surgery, if they are encouraged to do a little bit of exercises, pelvic physiotherapy, meditation, yoga, that goes a long way. And that can really help them increasing the circulation in the pelvis, which reduces the fibrosis and can give them a long term relief rather than putting them just on the drugs.
All right. All right. That makes sense, actually. That makes sense. I think this is something which everyone has to emphasize now. I mean, people going through any kind of a hormone therapy, I think, have to be really careful about what they're taking and also have to be very conscious about where they're drifting. You have to be very mindful. That's what I believe. And Dr. Sona, can you just explain a little about the psychosomatic component of the pain?
Yeah. So like I said, we got patients who are coming with a chronic pain, and when we talk to them, we recognize that they're really flooded with anxiety. And when we notice the pathways of anxiety, we see that the pathways could be discharged through their muscular system, the body, the ones which are used for voluntary movements, or
Yeah.
we have the internal organs where we have the autonomic nervous system activated. So once we can identify the symptoms of anxiety per se in a patient, that would be the first task, the first step, to be able to recognize that these are the symptoms of anxiety. And whatever
Okay.
we do, if you don't recognize that this is the outcome of the anxiety symptoms is all the crippling that is happening with this patient, and we don't identify and treat that, the symptoms are not going to go away. We also know
Correct.
with what Dr. Vimee was saying, that patients have been coming for so long and so long that actually when they come to us, we talked about what happens when they come to us. They're carrying
Mm.
a lot of hopelessness. They're
Correct.
carrying
That's
a lot of hopelessness and sadness, and of course a lot of anger, because nobody helped them. They've been suffering. Somebody told them don't bother about it. Somebody said it'll just go. Somebody just ignored it. Somebody gave them whatever medication, which didn't work. And they've had so many consultations and consultations and consultations and being treated with it, for gastritis, for migraine. But they're very frustrated and very, very angry. So it makes sense to just talk about this as well. Just normalize it. Just talk about how much they have suffered and what kind of emotions they may be carrying when they're coming for help. Because we know that, if they have this big chunk of emotions, the pattern that would come up would be that the more the emotions there are, the more the anxiety would be, and the more the symptoms would be. So,
true.
every time the patient comes back to you, they're just more depressed, and they're suffering much more. And this is all unconscious. They're not doing it. It's happening to them. So you
Correct.
see, every disappointment leads to a aggravation of the symptoms. Every time they visit a doctor, they just get worse and worse and worse.
Hmm. Correct.
And very depressed. Yeah.
True. Completely agree. Completely agree with that. So,
Absolutely. Sorry. Absolutely
absolutely.
agree, Dr. Sona, when you said that patient is running from one doctor to other and they are being misdiagnosed or delay in diagnosis is there, and especially with endometriosis, they are being dismissed repeatedly for the symptoms, for the reports they say, the pain they complain.
So there is no validation. People
Yes,
don't validate the pain.
yeah, they're
True.
not validated. Absolutely true. So, Dr. Sona, what is your advice? How these women should deal with their chronic pain? What is the best thing to do so that they can avoid anxiety and depression?
Okay, if maybe there are people listening in, and now that we identified that some of the anxiety symptoms would be, like we talked about, tension, aches in your body, in the muscle groups that you use for movement, or there could be the internal organs, which are, um, you're experiencing some blood pressure changes, you're experiencing asthmatic attacks, or migraines, or irritable bowel, or diarrhea, or sometimes you even get a little bit of fuzziness in the head and blurring of the vision. And so if you notice these kind of symptoms, urinary urgency, you go to the bathroom again and again, repetitively, a lot of thirst. So if you notice these symptoms, that there are pretty much anxiety symptoms. And if you notice that there's an aggravation of your pain, it would be nice to just sit back and think about what could have triggered, what interaction has triggered this anxiety in the day. What has made my symptoms worse? And then look at what emotions you would actually experience in this interaction. What is it that is getting, pushed away? So
Hmm.
just acknowledging them, just thinking about it, just understanding your emotions, just paying attention to your emotions,
Okay.
may just make you feel much better. And other than that, of course, with a lot of anxiety, there are other tools which one can use over a period of time. But even just acknowledging and journaling and writing your emotions helps a lot.
Absolutely. Absolutely. So, Dr. Sona, so you as a professional, you know, so what is it that you generally do to patients who come to you with symptoms of anxiety, depression, chronic pain? What do you do? I mean, how do you help them?
Oh, like I said, the first step would be to help them identify anxiety symptoms. And like I said, the first thing a patient will experience is a lot of relief, because now they know this is treatable. This is something we can work on. Because once they can identify that this is something, what's causing that, then it gives them a lot of relief. And then they're motivated to work on it. Because, if you're just giving medicines and they don't get relief and they don't know where it's coming from, it doesn't make sense to them. Now it can make sense to them. Okay, this is an anxiety symptom, and if you see this anxiety, anxiety can be treated. That's good news. The first
Correct.
step would be acknowledge it, and then, just like I said, we ask the patient to look at what they're really experiencing and what kind of conflicts are coming up, which aggravate the symptoms. Paying more attention to themselves. They've
True.
been told from a long time that you're not important and the symptoms are not important and don't bother about it. And unconsciously, they've got in a habit of ignoring themselves, ignoring their anxiety, ignoring
Correct.
their emotions. And now, when you sit with them and you just help them be more cognizant of
Hmm.
their anxiety and more
Hmm.
cognizant of their suffering and more cognizant of their emotions.
Okay.
Uh, uh, yeah, and that's something they keep practicing.
Hmm.
You're a teacher, you're just helping them identify it, and they just keep practicing and practicing till they get tuned in more and more to their real emotions without getting anxious.
Okay.
Yeah,
Okay.
experiencing the emotions without getting anxious.
All
And it
right.
takes a little effort, because that automatic response was just get anxious and don't show your emotions. And now it
Hmm.
gets a little more, opened up. And then because every step of the way, you might find the patient gets a little more anxious, because after all, they've been, they were anxious about acknowledging those emotions. So every step of the way is very gradual, very slow, helping them identify, helping them pay attention. Just a slow and gradual process
Okay.
of acknowledging your emotions. Yes.
All right. All right. That's That's quite interesting,
Yeah,
actually.
I can give you an example. So the other day, a patient came in and they said, "I've been just getting this chronic, since this Corona time, I've been getting this chronic chest pain." And he's
Uh,
been for echos and he's got a lot of investigations done. And I feel I'm getting a heart attack at night and I feel restless and anxious all the time. This pain doesn't go away. And then I
mm-hmm.
asked him, I said, okay, so you have this pain in your heart, and what kind of a pain is it? So he described it as a very stabbing kind of pain, and it's like stabbing. So I just asked him, okay, and if for a moment you just had a dagger in your hand and you didn't let this dagger come back to your heart, how would this dagger go? Where would this dagger go? Who comes to your mind? And he says, my dad. It's my dad. I'm really pissed off at him. But then he's my dad. I shouldn't be getting pissed off at him. You know, you got to love my father. And then
So
he
it's
just recognized,
conflict emotions.
yeah, it's like his conflict about, we're angry at a father who he loves very much. And then what he does to save the relationship, he turns the anger back onto him. And then it's like he gets a stabbing pain. And once he could visualize it and once he could just look at his father, the pain disappeared.
Okay, all right. That's what I'm saying. It's all linked. It's all linked. It's
Yeah.
so strange. It is. Um,
All about relationships. All about, yeah, all about relationships.
Yes,
Absolutely.
I think it's all interrelated and interconnected when we talk about relationships and symptoms, conflicts. So
Yes.
I would like to ask Shilpa. I must tell you that Shilpa is endometriosis survivor and she has fought it very well. She has undergone a lot of surgeries and she has, I think, tried all the medications available in the market. So, Shilpa, I would like to know, can you brief us about what all medications you took and how it affected your overall health and day-to-day life?
Uh, See, with me, when I was diagnosed with endometriosis, and the first surgery which I had to go through was in an emergency. I didn't even know that I had endometriosis. So obviously, when I got to know that I was endometriotic, and the first thing the doctor gave me was Leupride. Okay, so those were those injections of Leuperon that I took, and it put me off completely because the kind of hot flashes that I was having, I mean, I was sweating in one moment, the other moment I was feeling cold. I didn't know what's happening. I had a brain fog. The pain was lesser, but saying that everything else was going haywire you know then from there I was shifted to Dynogest, which is a progesterone analog, I guess. So I was put on that for a while, and it was the most terrible time in my life because I was going through a horrible depression. I generally am not a person who would cry or who would see the negative of everything. But in those days, probably I used to be crying throughout the day. I used to go to the clinic, work on my patients. I used to smile because obviously I couldn't do that in the clinic. But I used to come back home and I used to cry throughout. And I used to tell my doctor that I'm going through this, and they just did not believe me. And now after 4 years, I know, because of those medication, I have got arthritic pain and I have bone pains, which I have, and I have a lot of bloating and all that stuff. Which I think the bone pain is something I think is not reversible, which is a side effect of the hormones and Leuperon. But I think that's how it is. That's the reason I really want to advocate people not to go take medicines without knowing the side effects of it. You know, so for me, that's how it is. And in the process, I surely have understood how to deal with chronic pain. If you want, I can tell you. I can give a couple of tips to our viewers. So, should I?
Definitely, Shilpa, we want that because I
Absolutely.
think many women are watching us, and then if
Yeah,
you give them tips, because
absolutely.
we have gone through that.
Yeah. So the first and foremost thing which I would say is breathing. Deep breathing and meditation is something which will help you completely. I wouldn't say you'll be cured completely, but then it'll take you a long way. You know. Then second thing is stress. however stressed you are, see, the thing is just not going to be okay. Just by getting stressed up about something, that won't help, It'll just increase the inflammation that is happening in your body. So reduce the amount of stress that you're taking. Third thing is exercise. I know it's a very it's very hard. It's very tough when you're having pain and you have to exercise. It's the toughest thing to do. But trust me, when you start exercising, the endorphins that are produced by exercising would automatically increase your, improve your mood. So that will reduce the depression that you're going through. Okay, join some support groups. Meet other people having similar problems. Track your pain levels, so that, and make a diary of what triggers your pain, so that the next time you go to your doctor, you're able to tell what triggers it, and what's the scale of pain that you're having. you know try giving yourself a massage, try taking a massage. Eat healthy, anti-inflammatory diet, and find ways to distract yourself from this pain. Do something that you love doing, develop a hobby, develop an interest which might just, keep your mind off that pain. These are little things which probably helped me come till here, and I still do it. I don't say that I'm 100% of where I should be, but I am getting there. So that's how it is with me. So
Yeah.
that's what.
That's
And
very commendable that you have dealt with this pain and you have come out of it.
no, I think, Vimee, that's one of the reasons why we made this group, Endo
Yes,
Crusaders,
I agree
right?
with
Because there are a lot of
you.
people like me who are suffering.
More than me, she keeps pushing me that we have to do something new again. I want to educate people. I want women to know that what is endometriosis and how they can deal with it better.
It's so essential. Yeah, it's so important.
It is.
So
So,
important.
That's
Shilpa,
what. Yeah.
one more thing I would like to ask is like, as a patient,
Hmm.
what you want that professionals like, maybe let's talk about general gynecologist. What they
Uh,
should be looking for, or like what you expect from them as a patient, like when your diagnosis is delayed, when your pain is dismissed. So we want to sensitize gynecologist also. It's not about patient only.
First and foremost, Vimee, what I think is, as a regular gynecologist, when a woman is going to a gynecologist, firstly, be empathetic towards the person who is coming to you. When the woman is saying that she's in pain, don't dismiss that lady by saying that it's just in your mind or it's normal. If somebody is coming to a doctor saying that there is pain, there has to be pain. Some
Yes.
people don't have, people don't make, they're not happy telling you that there is pain. They want to live a normal life. They don't want to keep going to doctors all the time. So firstly, be empathetic towards the patient who's coming to you. Secondly, try to give the minimal medication which is required. Just don't keep experimenting with drugs. It is not something which is right, because you give the medication and send the patient back, but at home your entire lifestyle, your quality of life gets hampered. So that is something I think which needs to be attended to. And a constant monitoring of the patient who is on hormonal therapy, that is something which is required, because they break down. And telling you, I mean, it's just not about me. I've seen a lot of women going through those IVF cycles. It is not easy. They have emotional turmoils going on. you know they are facing n number of things. So just keep a watch, just monitor, just tell the patient that you are there for them. You are accessible. Because these things are something which you don't know when it will start hitting you. So if you're not accessible, where is your patient going to go? Right? So that is something which needs to be done. And also, I think, Dr. Sona, I will come to you with this, that please let let us know what exactly, for a common man, the signs and symptoms of anxiety and depression, so that they can realize when they are getting into it. And with so many people going through issues, I think it's high time that people know about it.
Right. So we just spoke about the anxiety symptoms, and we just reinforce it so that People who join a little late can get to hear that. So the symptoms, like we said, are pain symptoms which involve the muscle groups. It could be a backache, it could be a migraine, it could be a migraine, it's a tension headache. It could be pains in the legs, wherever the muscles are involved. And then we have the other pathway of anxiety discharge, which is through the autonomic nervous system. So we have diarrhea, we have IBS, we have hypertension or hypotension or gastritis and asthma. So all these form another group of symptoms, which is like a little more anxiety. And sometimes people don't even, a person who's getting pain, he is so, stuck on the pain at that time that he doesn't even recognize. A lot of people don't even know this is anxiety. They can't even make out that they're anxious because they're
True.
just stuck on the pain and they're trying to deal with the pain. So just identifying these symptoms, helping the patient identify that these are anxiety symptoms and paying attention to that anxiety, which has been discounted. Forget it, forget it. So now you just get to pay attention. Other than that, if somebody has been having a constant pain over years and there's a sense of hopelessness and depression, then some of the symptoms that come with those states would be a depressed mood. Patient feels like crying. He feels hopeless. He feels worthless. He feels he's really not required and disinterested. He might feel suicidal, and he finds that his sleep is disturbed because sometimes it's directly because of the pain or other symptoms that he's experiencing. He has to go to the bathroom again and again. He might get nightmares, and his sleep is disturbed, or he may have this conscious ruminative kind of thought process, keeps thinking and thinking, and then um, uh, looks pretty disinterested and hopeless. So
Okay.
these would be constituting, a symptomatology or syndrome, what we call, of depression. So that's like, uh, in addition to the anxiety symptoms, there's this kind of depression as well, which uh, can just get kind of mixed up with anxiety and cause many, many more problems.
Absolutely.
Just Shilpa saying, okay, I've done all this, I have worked through that, so that's great because she got motivated to do something good for herself and take charge of her life and do whatever she understood. Like she thought, okay, this will help me. Let me try this. Let me try this. And she tried stuff, and then she said, okay, this is better. This is better. I choose this. So she had that motivation to do that. But a lot of people will just feel hopeless and just too hopeless
Correct.
to do anything good for themselves. So
Correct.
it's important to identify depression. And like you said, they may be in too much pain and they may feel too hopeless and too burdened to be taking good action, positive action for themselves.
True. True. That's right. That's right. Vimi, is there something that you would want to add in?
No, I like to ask Dr. Sona only. Suppose I have referred a patient who I identify that she is suffering from anxiety and depression. So apart from counseling, what kind of treatment she needs? Like, how do you manage them?
Uh, when the patient comes in, and if since I'm a psychiatrist and I'm also trained in a form of therapy, which is particularly involved in the body, paying attention to emotions and anxiety. Um, if the patient is very severely depressed and depleted of energy, like the patient has no energy and it can't get out of bed at all and they're suicidal, so we know that right now they're not in a condition to really do any kind of therapeutic work, like sit with you and talk because it's just depleted of energy. So those
Correct.
kind of patients, it's better, it's advocated that you put them on medication till they're in a condition that they have the kind of energy to sit with you and work with you. It's just too much pain and too much depletion. They haven't slept for days, they haven't eaten well for days. You have to give them some medication first. So we give them antidepressants to start with, and there's a whole range of antidepressants you can use. And then once they're a little better, if they are willing, we can invite them to do some work with, their emotions and their body and their anxiety subsequently.
Okay.
So more severe cases would definitely require the medication first before they have any energy to do any work with you.
Correct. 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 That's right. That's right. But what I also feel is, I think with the gynac, when you, Vimee, as such, you consult a lot of women. So I
Yes.
think with the normal consultation, uh, we should also have an analysis of how stressed or how what anxiety scale that the person is on, before giving them medication. Because if the patient is already undergoing anxiety or depression and you're putting them on hormones, imagine the kind of a cocktail it'll make. It'll be like a disaster completely. So I think there has to be an anxiety scale that the person has to be, judged on. And if required, then a counseling session has to be, in place already before any treatment starts off. That's what I think, you know.
Uh, See, we all know that from a patient's perspective and experience, like chronic pain or be endometriosis, it is characterized by mainly six major challenges and the stressors or the triggers. One is diagnosis is delayed, cause of the disease is unknown in few cases. It is a chronic recurrent disease, and
Correct.
mostly it affects young women. They are handling their work, they are handling the family, handling the marital relationships. So they are doing everything along with this pain. And it is also causing painful sex. And more stressing is infertility.
Absolutely.
So this all together leads to the stressful life, and her quality of life decreases. This creates a psychological need for patient which should be responded by an integrated basic psychosomatic care, what we call,
Hmm.
which includes what we were discussing, what you said, that empathy, very
Correct.
important, respect, and listening skills to the patient's story.
True.
I think if we listen to them, half of their pain goes away.
Absolutely. True.
Patient, we have to have a communication which is patient centered. There should be an adequate response from the physician to their negative emotions, not that we should dismiss it.
Correct.
There has to be a establishment of a helpful and lasting therapeutic relationship. That patient, some of the patients tell us that, doctor, the moment I see you, my pain goes away.
Correct. I
So
know. True.
that connect we need to develop nowadays.
Absolutely. Absolutely.
One more component is psychoeducation, and we need to make the patient empowered, that they know everything about it. If I write diagnosis, she should know what it is, what are the
Correct.
side effects,
What
how
is
long she's going to take it, why she is taking it. I tell you, I was doing a teleconsultation a few days back. The patient, as soon as the unlock started and lockdown was lifted up, patient moved from Hyderabad to Bangalore. And after going there, she is still consulting me, saying that, doctor, I go to the hospital and they give me the drugs. They don't tell me anything.
correct?
I want to continue consultations with you, so that, because you used to tell me, even if you're giving an injection or a tablet or any paracetamol also, why you are giving me.
Why? Absolutely. Absolutely.
And it has to be a shared decision making. I should not be taking decision on their part. I have to involve them in their decision taking. I have to give them the options, what I am going to offer them. So if
Correct.
it is a shared decision making, definitely it will be going to go a long way, and it really gives a better relief in terms of pain or any psychosomatic symptoms also.
Correct. That's right.
Apart from these, which we are talking in terms of endometriosis or chronic pelvic pain, we should have an integrated service where we offer chronic pain services, infertility treatments, sexual counseling, therapy, and treatment of psychiatric comorbidities. As you
Correct.
said, there should be a scale which we should be doing it, and we should be monitoring them. That should be an integral part of our care for chronic pelvic pain patients.
True.
So,
True.
psychosomatic care has to be included when we talk about the management of chronic pelvic pain.
That's right. That's right. See, because dealing with chronic pain is one of the most difficult things to do, because the person having pain for a day, the entire mindset goes for a toss. So imagine a person going through pain for months or years at a stretch. So, so it's not easy. All that we are asking for is a listening ear and some techniques which will help us deal with the pain. Dr. Sona, I think we'll conclude this session with the statement that mental health is as important as your physical health is.
Thank you.
Absolutely. So, thank you so very much for this informative session, Dr. Sona. Vimee, thanks again. I mean, it's always so nice co-hosting the event with you, you know.
Thank
That
you,
was a
Shiva.
pleasure, Shilpa.
Thank
And
you.
you put in so much of efforts that I really
Effort.
like.
Nay,
Yes.
thank you so
Yes.
much. Dr. Sona,
Wonderful.
I would love to do a session with you all over again. Maybe some
I'm
other
sure.
topic. We will surely do that soon. Yeah.
I'll
Thank
be
you
so
so
happy.
much.
Thank you so much.
Somebody was
Any questions there?
asking, somebody was asking your contact how they can contact you.
Can we put it in the group, Dr. Sona?
Sure. That's not a problem.
So you can put it in the comments if you like. Any contact number, they will contact you, or any telemedicine facility, consultation facility. So
Yeah,
they will
I'll
do.
just put on my email so they can mail me. They're welcome to mail.
absolutely. That would be
Yeah,
fine.
absolutely fine. Absolutely fine. I have your mail ID. I'll put it here. drsonakakar@gmail.com.
Yeah, I put that here.
Yeah, I
And
got
it's
that. Got that.
Okay.
Okay.
So I'm putting in the comments.
Dr. Sona has already put in
Yes,
on
she has
I
put it
think
on
it's
the
come in a
chat.
private chat. I think it's come
Facebook.
in a private chat.
I have put it in the comments.
Fine. Perfect.
Okay.
Chalo. All right. Thank you so much, everyone, for joining us. Whoever has joined us, thank you so very much for joining and making this session a success. And I hope this really helped all of you. Thank you and
Thank
bye
you,
bye.
Thank
Shilpa.
you.
Thanks,
Thank you,
Naveen.
everyone.
Thank you,
Bye.
everyone.
Bye.
Bye bye.
Bye.
Bye.